Thank you, Mr. Speaker, and I appreciate the opportunity here to respond to some of the criticisms that have been here, unjust as they seem to be to me, and try to straighten the record out just a little bit. It is our belief on this side of the aisle that the United States government and the government of many of our states have a moral mission to protect our citizens, moral mission to empower our citizens, and a moral mission to improve the lives of many of our citizens. And the issue of health care reform to us on this side of the aisle is a moral issue, and it's an economic issue. And when we see throughout our country the level of abuse that has been put upon the people of this country through the insurance system, that, my friends, that, Mr. Speaker, is a moral issue. Nobody is saying that this health care reform bill is a perfect bill. Nobody says that it's going to be a panacea, it's going to fix all of our problems in this country. But this is a major step forward for our country. And we have, as a country, a moral obligation to stand up between what the insurance industry is doing to the American people. Somebody has to intervene. And there is nobody left, because average people who are in Ohio or Iowa or some of these other states have no recourse. They cannot battle the insurance industry. This has been going on for years and years and years, where the insurance industry kicks people off the rolls when they need coverage or when they get sick, when they deny people coverage because they have a pre-existing condition, and so they therefore can't get any insurance at all. And they've created a system here over the past few years, past 5, 10 years, where we see 20, 30, 40, 50% increases in health care costs for individuals and small businesses, and large businesses in many instances, and the government. So we have a situation where we need to address, we're that far from addressing one of the great moral issues of our time, and we're that far from addressing an economic issue that will continue to strangle the economy of the United States of America if we fail to act. Now, I think it's very convenient for our friends on the other side of the aisle and those in the insurance industry to say, let's start again. Let's start all over. Let's start from scratch. Well, if the insurance industry wants to go back and revoke 10 years of increases that they've bestowed upon the American people, if they want to start over, then maybe we'll start over. If they want to eliminate all of the increases that they put on the American people, eliminate them all, let's go back to 1995 or 1994 rates, or even just cost of living from 1994 or 95 when we tried to do this the last time. Why doesn't the insurance companies start over, Mr. Speaker, and go back and erase their increases that they put on the American people? Then we may consider starting over. Now, for those people, Mr. Speaker, who've been listening to this debate, they need to recognize that maybe this process isn't pretty. And maybe we could have done a better job explaining what's going on. And many people, and our friends on the other side, were talking about polls. And at the same time would lament the fact that many were governing by polls. So, when we look at what has happened over the course of the past few years, and what's happened to average people, I want to find the poll that we had here, when you pull out the issues from the poll. So the general consensus is, do you want the health care? And they hear on the news, Mr. Speaker, about different things that are going on, and they say, well, doesn't sound like such a good idea. But then when you pull out specific provisions of this bill, of this health care reform proposal, most of those issues, most of those reforms poll at 60, 70, or 80% support. Are you for getting rid of pre-existing conditions and allowing insurance companies to not cover you because you have a pre-existing condition? 60, 70% of the American people support that. Do you support eliminating lifetime caps so that when you get sick and you really need the insurance, you can get it? 60 to 70% of the American people support that. Do you support not being able to deny every child in the United States of America because of a pre-existing condition? 70, 80% of the American people support that. Do you support giving small businesses tax credits to cover their workers? Significant support for that. So we are moving forward with a proposal that addresses the major needs of the American people. When you ask seniors, are you for closing the donut hole? More than a majority of seniors say yes, that is something that we want included in the health care reform proposal. And it is included in here. And many of these reforms will go into effect within the next year. And so when we pass this, Mr. Speaker, and our friends campaign in November about repealing this, they're going to have to go to all the moms and dads in the country and say, no, you know how your child, if they get sick or we want to get insurance, they can't be denied because of a pre-existing condition. They want to run a campaign saying, no, we want to repeal that. Our friends on the other side of the aisle, when we say you can't be denied coverage for a pre-existing condition, they're going to want to run a campaign saying, no, we want to repeal that. When we close the donut hole and start moving in the direction of fully close the donut hole that the Republican Party put in here when they passed a prescription drug bill that they didn't pay for, we had to borrow money for China to pay for it, and it has a donut hole in it, and we attempt to close it, our friends on the other side of the aisle are going to run a campaign in November saying, we want to repeal the closure of the donut hole. Those are the issues that are in here, that are in this reform proposal. And these are the issues that are going to bring some justice to the healthcare industry in the United States of America. This isn't about whether the government's going to run healthcare or the insurance industry is going to run healthcare. This is about whether doctors can make decisions. And our friends on the other side want to talk about life and liberty. Let's talk about life and liberty. Let's have this debate. You want to talk about freedom? How free are you when you're sick and you can't afford health insurance? You can't get out of bed to go to work. You have to give up your job because you don't have health insurance. How free are you? I cannot be convinced that the founders of this great country thought that freedom is somehow the government not protecting individual citizens from underhanded practices from a corporation. I can't believe it. I believe that the definition of freedom is about being healthy and empowered in 2010 in America. And if there is a corporation or an industry that is limiting your freedom by their underhanded practices, then the government has a moral responsibility to intervene and to protect the individual citizen and protect the rights of the individual citizen. Let's have this debate all day long, Mr. Speaker. telling me some bogeyman is being created here that's going to come in to Washington, D.C., and my one friend said, nationalizing our bodies. One of our friends on the other side said that this was about nationalizing our bodies. What? Talk about fear-mongering, Mr. Speaker. Nationalizing our bodies? This is about protecting individuals in the United States of America who can't protect themselves. And the government has a moral obligation to do it. If it's a foreign terrorist, moral obligation to do it. If it's crime in the streets in our cities, moral obligation to do it. If it's an unruly industry that has underhanded business practices, moral obligation to stop it. That's what we have here. That's why we're here. That's how this country was founded, to protect the individual freedoms. And to say to small business people, you got to go out into the shark-infested waters to try to get health insurance and have 40, 50, 60% increases and do nothing about it because of some warped concept of freedom that is made up? How free is that business person who takes money continually out of wages, out of capital investments into their factories, into their machine shops, into their businesses, into their technology, into training their workers? They're not free to make good business decisions. They probably have all kinds of good ideas about what kind of investments they would rather be making than paying to some health insurance company that doesn't give us value added. You want to help manufacturing in the United States of America? Help fix some of the health care burdens that our manufacturers are plagued with, day in and day out. And how many factories were shuttered because they couldn't make the capital investments because they had to put so much money into health care? How many? We've seen the decline in manufacturing over the last 10 or 20 years. We've seen stagnant wages over the last 10 or 20 years because businesses had to absorb health care costs while simultaneously trying to compete with China and India and manufacturing all over the globe. And our friends on the other side want to start all over. And they want to tell all these people who are getting denied because they have a pre-existing condition, we need to start all over and wait another 100 years to do it. Or at least another 15 years. The last time someone had the courage, like President Clinton had, to try to do this. We've got an obligation to fix these problems. We didn't get sent here to take polls. We were sent here to do the right thing. And it is my hope that this week, it was great today. We were in Cleveland with the president. And he was in the middle of his speech, and he said something like, what we need, and there was a pause there, and a woman shouted out, we need courage. We need courage. That's what people are feeling. They feel like there's no one there to help them. They get stuck in situations where they don't have anywhere to turn. And imagine the United States government passing a law that says when you get sick, you can't get kicked off your insurance. That's what's in this bill. That's what's in this bill. That's why when you look at the list of faith-based organizations who are supporting this bill, Sojourners, Network, Catholic organizations, Evangelicals for Social Action, Jim Wallace at Sojourners, Catholics in Alliance for the Common Good, New Evangelical Partnerships for the Common Good. I mean, a former Associate General Secretary for U.S. Conference of Catholic Bishops, Sisters of Mercy of the Americas, Boston College professors, University of Dayton professors, Marquette University professors, on and on and on and on. And then this weekend, a huge endorsement for this bill, as my friends on the other side were talking about. We're talking about the abortion issue. 25 pro-life Catholic and evangelical leaders have endorsed this bill. And this weekend, the Catholic Hospital Associations endorsed this bill. Do you think the Catholic Hospital Associations of America would endorse this bill if this was a pro-abortion bill? This is the pro-life bill. This may be the most pro-life bill that has passed this House in 20 years. The number, how do we define life? How many people die too early because they're sick and they can't get the proper care? How many people have a reduced quality of life because they can't get proper health care? Aren't those pro-life issues? They most certainly are. And to have the Catholic Hospital Association endorsing this bill and then to come out and fearmonger, Mr. Speaker, on the abortion issue is wrong. It's wrong. 25 pro-life Catholic and evangelical leaders, strong, nationally recognized, endorsing this bill. Because this is a pro-life bill. And we should support it as a pro-life bill. You know, we talk a lot about freedom, too. How many people in America today are out there locked in a job that they probably don't like all that well, that they'd probably rather go work somewhere else, or maybe even better start their own business, but they can't leave their current employment because they know if they go out into the free market and they try to get their own insurance, that they won't get covered because maybe they have a pre-existing condition, or maybe their spouse has a pre-existing condition, or maybe one of their kids has a pre-existing condition. So our friends on the other side have said, start over, don't do that. Don't give that person who got an idea and wants to start a business in America and take a chance, don't help them. Are we providing the kind of environment for someone to express, have freedom to express their energy and their talents in America? No, we're limiting it if we don't fix this healthcare system. We're limiting it. And we have a moral obligation as a country to allow each and every individual in this country to express their talents and their skills in this country. We have the opportunity here in the next week or so to make this happen. We've never been so close, extending insurance to 30 million Americans who currently don't have it. A lot of people say, too, as we talk about this bill, that they don't want to pay for these 30 million people. And it's important that we recognize that we all are already paying for these people who don't have health insurance. And you see, our friends on the other side, and I sat here and I watched them, and I listened very carefully. And they were picking these fringe issues to try to incite. They were talking about abortion, which is okay. Sure they believe strongly in that. I do as well. I have a pro-life voting record. But when you have the Catholic Health Association and you have 25 national Catholic and evangelical leaders supporting this bill, it becomes very difficult to scare the American people about that issue. They don't want to talk about pre-existing conditions. They don't want to talk about making sure kids don't get denied. They don't want to talk about small tax cuts, tax credits for small businesses to provide health care insurance. Of course not. They don't want to talk about how the Democrats are going to close the donut hole. They don't want to talk about how seniors will not have to pay for any preventative care at all in Medicare. They don't want to talk about how this bill is deficit neutral, how it actually reduces the deficit. They don't want to talk about how this bill extends the lifespan of the Medicare program. They don't want to talk about any of that stuff. And it goes back to the original memo that one of their top pollsters gave them in the spring that said, do not let Obama pass health care reform. Do not let him. You'll be in the minority for a long time. And so they will do anything they can, anything in their power, to try to prevent this president from passing health care legislation. It's good to know, Mr. Speaker, because they're rooting against the president. They're rooting against the president. If the president fails, we all fail. He has extended his hand, taken all of the Republican ideas, put many of them into the health care reform proposal, and there still are Republicans that won't vote for it, just like in the stimulus package. We had to put $300 billion in tax cuts in the stimulus bill because that's what the Republicans wanted, and we didn't get any Republican votes because there's no benefit from the Republican side to support the president, to support the American people, because politics has gotten in the way. And so we have all of these issues that are going to go into effect within the year. In the year, small business tax credits, up to 35% of premiums, will be immediately available to firms that choose to offer coverage. Closing the Part D donut hole. Immediate help for the uninsured now to create a interim high-risk pool. End rescissions, so insurers can't drop people from coverage while they get sick. No discrimination against children with pre-existing conditions. You going to vote against that? Go ahead. Extends coverage for young people up to the 26th birthday. So all the young people in our country will now be able to stay on their parents' insurance until they're 26 years old. So if you want to go to grad school, you'll be able to stay on your parents' health insurance. Times are tough now. You may not be able to find work, or at least find work with some decent health care. You can stay on your parents' insurance until you're 26 years old. Ban lifetime limits on coverage. Bans restrictive annual limits on coverage. Free preventative care under Medicare. This is a reform proposal that we should have passed 30 years ago. Those are the moral issues. But the economic issues are just as profound, just as great. Small businesses have seen a 126% increase over the last 5 or 6 years. And the projections as we move forward are even higher. For families and small businesses, up, and away. Well, their health care costs go if we do nothing. And as we said, they want us to start over. Well, how about the insurance companies start over? How about the insurance companies repeal 10 years of increases and they start over? Maybe that would be fair. Wouldn't that be nice? We want to start all over in this country, come together and figure something out, repeal 10 years of your health care increases. Free preventative care under all the new health care plan, new independent appeals process, help for early retirees, which is something that's huge, I know, in Ohio, creates a temporary reinsurance program until the exchange is available to help offset the cost of expensive health claims for employers that provide health benefits for retirees aged 55 to 64. Billions of dollars for community health clinics, and increases the number of primary care doctors by making huge investments into making sure that we get that done. The Republicans didn't do anything to address any of these issues for 10 years. Now all of a sudden they're late to the game. And they still won't support it. They say, well, we're for repealing pre-existing conditions. They're not going to vote for this bill. We're for tax credits for small businesses. They're not going to vote for this bill. We're for closing the donut hole. They're not going to vote for this bill. We're against pre-existing conditions, making sure that any child doesn't get denied coverage because of a pre-existing condition. They're going to vote against this bill. We're for children allowed to stay on their parents' insurance till they're 26. They're going to vote against this bill. We're for increased competition. They're going to vote against this bill because they've been told by the people who guide their political decisions, their pollsters, the cottage industry in Washington that tells political parties what to do. They've been told, do not let the Democrats succeed at this. And we've asked time and time and time again for their suggestions. The president has taken many of them, implemented them into this bill, and they keep moving the yardstick further and further down because they don't want to support this because their political leadership, their pollsters, their lobbyist friends say, we can't do it. We can't let them get a win. And it's not about the Democrats winning. This is about the people in our district who are getting hurt, that are getting hurt by the current practices. And when you see the number of faith-based organizations supporting this legislation, evangelical, Catholic, Jewish, Muslim, Buddhist. I mean, the spectrum of faith-based organizations in the United States of America are supporting this. And they all say, is it perfect? No. Of course not. This is a body made of human beings who are flawed and make mistakes. But this is a tremendous step forward in our country. Monumental, historic. I'm proud to be here today. I'm proud to support this bill. I'm going to be even prouder after it passes and we can point to X, Y, and Z, as I am tonight, exactly what's in here and exactly what the benefits are. And I'll be honest with you, I'm excited to run a campaign in November talking about this. I want to see the campaign where all of the stuff that I just listed is the debate in the fall. And our friends on the other side and our Tea Party folks who haven't done anything in 10 years to try to address any of these problems are going to want to repeal a ban on pre-existing conditions for kids, children, a ban on pre-existing conditions for adults, saying that you shouldn't be able to stay on your parents' health insurance till you're 26. They're going to run a campaign saying that we should expand the donut hole instead of close the donut hole, which is what we're doing in here. They're going to run a campaign saying we want to repeal the tax cuts that we have given to small businesses to try to make this happen. We want to repeal the subsidies that people are going to get to help them pay for insurance. It's going to be a heck of a campaign.